Hey, my name is Helena Grönqvist and I work as a researcher in the Strategic Research Program UCare, hosted by the research group Clinical Psychology in Healthcare here at Uppsala University. Today, I'm going to talk to you about why we should be involving the patients and the public in the work that we do that is directed towards them. I will also be talking about different levels of involvement and how involvement can be carried out. At the end, I will also give you some food for thought about how you can involve the public when planning an outreach activity. As professionals, clinicians or researchers, we are used to doing things that are directed to patients or the public. In recent years, there has been a shift of mindset where we no longer do things to, about or for the public, but rather do things with them, or indeed, some things are run entirely by them. Service users are moving from being receivers to becoming co-creators. In Europe, the UK has taken lead on this work, and public involvement has become an integral part of the developing society. Involving the public actually takes quite a lot of resources: building a community, building trust, setting up meetings, discussing important questions, and open up to new perspectives and ideas. A legitimate question to ask is, why should we do this, and is it worth it? One could argue that public involvement is a core democratic principle. By this I mean that people who are affected by research or a service have the right to have a say in how the research is undertaken or how a service is delivered. This is especially the case if the research or the service is publicly funded. In addition, public involvement can lead to empowering people who use health and social care services. It gives them a way to influence change in the issues which concern people most. Public involvement systematically utilizes experience-based knowledge and strives to change the relationship between users and professionals so that new balance of power is created. But besides the democratic argument, whereby citizens are empowered by becoming co-creators or partners, what other arguments are there for public involvement? Well, members of the public might have personal knowledge and experience of a research topic or a public service, or be able to provide a more general perspective. Even if you are an expert in your field, your knowledge and experience will be different to the experience of someone who is using the service or living with a health condition. Incorporating those perspectives may improve accuracy as well as relevance. This can be done in many different ways. For example, by making the language and content of information provided more appropriate and acceptable to the target group. It can also be done by helping to ensure that methods proposed for a research study or when interacting with citizens are acceptable and sensitive to the situations of potential participants. It could also be done by helping to ensure that service outcomes, an outreach activity or a research project are important and relevant to the citizens it is directed to. In addition, there is an increased pressure from funders and special interest organizations to involve the public. So, how should we go about involving the public in our business? How questions have many answers. So let's start with looking at different levels of public involvement. In practice, a project can include several levels of public involvement, and they do not have clear-cut boundaries. However, understanding the levels of involvement may help us to learn more about the different approaches to involvement at various stages of our work. There are three main levels of public involvement: consultation, collaboration, and user-controlled. Consultation is when you ask members of the public for their views and use these views to inform your decision-making. Consultation can be used in any stage of the process, from identifying research topics, areas for service improvements, through to interpreting and understanding research findings. You might, for example, hold one-off meetings to ask people's views on the importance of a service or a piece of research. Research funders may consult members of the public by asking for their views on research grant applications. Collaboration involves an ongoing partnership between you and the members of the public you're working with, and decisions are shared. For example, members of the public might collaborate with the researchers on developing a research grant application or improving a service, be members of an advisory group, and collaborate with researchers to disseminate research findings. User control refers to practices where users are responsible for making the decisions. In research, user control would refer to research that is actively controlled, directed, and managed by service users and their service user organizations. Service users decide on the issues and questions to be looked at, as well on how the research is designed, planned, and written up. Service users will run the research advisory or steering group and may also conduct the research. In the UK, there are organizations who support this kind of user-controlled research. Within a service, user control would mean that the service users would be developing the service itself. The service would be directed and managed by service users and their service user organizations. So, how does patient and public involvement affect your work? Your task is to create an outreach activity to promote healthy living and active aging. Can you improve the outcome by involving the public when planning it? I certainly think so. But what do you need to think about? Let's start with who are in your target group. Who are the people you want to affect by your outreach activity? People from this target group may be the ones you want to involve when planning it. And at what level do you wish to involve the public? Do you want to use consultation, collaboration, or even user-controlled? And are your choices feasible? Another thing to think about is what aspects of your outreach activity do you wish to have input on? Do you want to have input on the whole activity, or are there certain aspects you wish to focus on? I will leave you with these questions, and I wish you all a successful outreach activity and happy public involvement.